Good morning, everyone. Gene Nichols back with you. Dr. Rick Axelrod joins us from LifeStream Blood Bank. He doesn't do much in his spare time, but then again, he's the medical director, he's the CEO, and among other things, he runs LifeStream Blood Bank for the entire Inland Empire here in the Coachella Valley. All they need to do is provide all the blood products, the three major facilities here in the Coachella Valley, the high desert, and all the way out east to Blythe and west to San Bernardino. Dr. Axelrod, welcome.
Well, thank you very much for having me.
Great to have you here. I know you're modest about the job and the task at hand, but it's never been bigger as we now start seeing at least a resurgence of a new variant of COVID-19, which just makes your job a little bit tougher to try to get people in to donate.
It does. We've been struggling through the entire pandemic to make sure that we have enough blood donors to come in and donate. Particularly what's happened most recently is when it looked like we were doing better as it relates to a decrease in COVID cases, all of the people who had postponed their surgeries previously all were now being admitted to the hospital to have their surgeries. So we saw an increase in blood usage and need, where at the same time, because we now had a decrease in COVID cases and things were opening up, people wanted to do a whole bunch of things like go out to the park and go to the movies and go out to dinner. And the last thing they were thinking about was donating blood. So we had two things going on: increased usage at the hospital and decreased donations at the blood bank. And as a result of that, we are in the middle of a big shortage. So we really, really need our donors to come in and support us. It is really critical to have them support our mission for saving lives.
We're always hearing about guidelines from the state, from the feds, from the regional and local agencies and government levels. Give us some guidelines regarding COVID-19. Who is allowed to donate pending their COVID-19 vaccination? How much time should they wait after they might get a vaccination? So folks will have an idea on whether they feel comfortable coming to the blood bank.
Okay, so first of all, let's start with masks. Because LifeStream is considered a healthcare facility, everyone has to wear masks. So our employees are wearing masks, and all donors have to wear masks in order to donate. Now, as it relates to vaccination, everyone can donate, whether they're unvaccinated, whether they've had one vaccination, or whether they've had two. But what I will say is that we are aware that individuals, after they get their second vaccination, are more at risk of having side effects from the vaccination. These are mild flu side effects. Don't happen with the first one, but generally happen with the second one. So what we recommend is if you haven't been vaccinated, okay to come in and donate. You just have to wear a mask. If you've had one vaccine, it is okay to donate even after that day that you've been vaccinated. If you want to come in that day, that's fine. And again, you have to wear a mask. But on the second vaccine, after you have the second one, it's probably best to wait 24 or 48 hours to see whether you're going to have any side effects. Because usually what you have is a bit of fatigue, a mild elevated fever, and some muscle aches. So the fever alone would have you be deferred temporarily from donating blood. So it's probably best that you wait 24 to 48 hours after the second vaccine before coming in to donate. But again, reminding everyone, no matter who you are, you have to wear a mask when you come in, and our employees will be masking as well.
And of course, there are a lot of people who don't get any kind of reaction to the vaccine, but just in case, as you say, out of a precaution, they should wait a couple of days, because sometimes it takes a couple of days to even get that reaction if you're a person who's going to get it.
Yes, generally within 24 hours, anybody who received a vaccine generally will feel symptoms if they're going to have them within 24 hours. Sometimes it might take a little bit more than that, so I would recommend, just to be safe, wait 48 hours after your second vaccine before having your appointment or walking in to donate at one of our facilities.
We're talking with the CEO and Medical Director of LifeStream Blood Bank. He's Dr. Rick Axelrod. I'll give you the toll-free number, not to talk to him necessarily, just to try to sign up for a blood donation. Make an appointment at 1-800-TRY-GIVING. That's 1-800-879-4484. You can go online to lstream.org and do it as well. They've got blood donation centers, of course, located in La Quinta on Corporate Center Drive, right next to the post office there, off 111 and Adams and also in the Hobby Lobby parking lot in the shopping center at Highway 111 and Bob Hope Drive in Rancho Mirage. They've got a lot of the mobile drives now that are starting to ramp up because, Doctor, you folks are literally almost halfway through the 9 Cities Summer Blood Drive Challenge here for 2021. It ends on the 31st of August, and we have a town that's in a familiar place leading the pack right now, don't we?
Yeah, Palm Springs is currently leading the challenge. Every summer we have the 9-City Challenge, which is a friendly competition between the 9 cities in the Coachella Valley to see during the 2-month period which city can collect the most blood. And different cities have won this event. Indio has won it, Palm Desert has won it, Palm Springs won it last year, and currently they're in the lead. They want to be a repeat champion. So we are asking all of the cities to challenge Palm Springs. If they want to win it again, make them work really hard to win it. Everybody should donate. We really need the blood. And if you donate blood, there are a whole bunch of recognition items that we give you. You get a 9 Cities Blood Drive Challenge t-shirt, a $10 Stater Brothers gift card, and a LifeStream-themed Count on Me beach towel. It's summertime. We're going out to the beaches or the pools, and we give you a towel to help you in that effort to play in the water.
I know walk-ins are welcome at both of the fixed center locations, and even the Bloodmobiles will accept walk-ins, but especially with COVID these days still hanging around, you would prefer and make it easier on everybody, the staff and the donors, limit the waits and make an appointment, especially when it's 110 degrees in the shade out here.
That's correct. We prefer people to make an appointment, and as you mentioned, 1-800-TRY-GIVING or lstream.org. On the website, which is really, really easy, you go to lstream.org, say that you want to donate blood. You could put in your zip code, and it'll do 2 things. One, it'll tell you the closest donor center near you, or if you want to donate on a blood drive, it will tell you the blood drives that are coming up in the next 2 weeks in your area that you can make an appointment there as well. So, yes, I agree that in this environment with the heat in the Coachella Valley and with COVID, it is best to make an appointment, but we will take walk-ins if you're not able to do that.
After donating for several years here in the Coachella Valley, the questions that are on the questionnaire when I donate have changed, and you folks have to constantly be aware of what seems to be ever-changing or ever-updating federal regulations as to who can donate, who has traveled somewhere that might make them ineligible to donate. That's something our listeners and folks who donate have to be aware of when they get in there as well. So if you can, sum up for us some of the things that might disqualify somebody and how those may have changed over the last year.
Travel is a big one. So basically, it depends on the countries that you travel to. The biggest issue is whether you travel to an area that has the risk of getting malaria, and that's the big issue. So, it's very easy to find that information on our website. When you go in there, all of the donor information is in there, but that's probably one of the biggest things that we have to worry about as it relates to blood donation. The other thing that we're still challenged with is males who have sexual contact with other males. Just so that your listeners know, the blood centers have all been challenging the FDA to eliminate that deferral, that we feel that this population can be safe to donate. We test the blood supply. Just to remind everyone, originally the deferral for males who have had sex with male were lifetime. Then it got changed to a 1-year deferral, and now it's a 3-month deferral. And in fact, during the COVID pandemic, because people were isolating and weren't, particularly people that were single, were staying to themselves and not interacting with other people, we actually had an increase in the number of gay blood donors donating to us because they were now able to answer the question, yes, that they have not had sexual contact with another man in the 3 months prior to coming in to donate. So that was, a positive effect of the pandemic, if you want to look at something like that. But, we're still challenged with that deferral, and we're working hard that hopefully in the next couple of years we'll be able to have that deferral completely eliminated.
Our final few minutes with Dr. Rick Axelrod, Medical Director and CEO at LifeStream Blood Bank, talking all about blood donations. Now, we talked about the COVID-19 vaccine, Dr. Axelrod. What about someone who has actually had COVID and has recovered. Is it safe for them to donate, and do you still need their convalescent plasma?
The convalescent plasma program has been suspended for the current time because the amount of plasma that was collected is more than enough to cover the inventory needs of our hospitals. And because the COVID rate had gone down considerably, that product wasn't in as much demand as it was, let's say, 6 months ago. We may revive that program in the future if the Delta variant really causes significant problems in our region. But for people who have had COVID in the past, not an issue at all. They can come in and donate. They're as good as any other donor. But right now, we're not collecting their plasma separately for convalescent plasma for patients in the hospital. We have about 1,000 of those units in inventory. So we have more than enough right now to meet the needs of the patients in our community.
Great. So somebody who has had COVID in the past, has recovered, and is feeling strong and healthy, just as any other blood donor, they can go in and donate now as well.
Yeah, and I want to reiterate to the donors, one of the biggest challenges that we have is people self-defer themselves because they think they can't donate because they've had some sort of medical situation in the past or maybe even have a medical situation now. And to give you a couple examples, if you have diabetes, you are okay to donate as long as you're controlled and following your sugar levels or you're on insulin, no problem donating. If you have a history of high blood pressure, if your blood pressure is now controlled with medication, you are absolutely able to donate. If you have a history of a heart attack, as long as you are fully recovered and back to regular activity, you are okay to donate. If you have a history of cancer, as long as you've been treated and cured and you are free of treatment and signed off by your doctor, you are absolutely able to donate. So I really want to reinforce that there are very few situations that require a deferral of donors. And one more I want to mention, there's no upper age limit for donating. We have people in their 80s that are donating regularly with the blood bank. So don't defer yourself just because you might be 78 years old or even 83 years old. You are okay to donate as long as you're active and physically healthy. We would love to have you as a blood donor. What we want is for people to come in and donate. Most of the people will be able to donate and pass all the criteria. There will be a few that don't. But the one thing I tell the people that don't is you've just gotten a free mini physical, right? We take your blood pressure, we take your temperature, we check your iron level. There's a whole bunch of things we do that you sort of get like a little free mini health exam that you would have to pay a couple of $100 for if you had to go to the doctor, or at least you'd have a copay from insurance. So even if you might be deferred, you'll learn some things about yourself to know that you're physically fit in other ways.
So here are the blood drives coming up this week. Tuesday, July 27th at Lowe's on Ramon Road in Palm Springs from 10:30 till 2:30. Thursday, the 29th of July from 11 to 5 at the Indio Teen Center, Avenue 46. Friday, July 30th, Southwest Community Church, Indian Wells from 8 till noon. And Saturday, July 31st at Nitro Infusions, Main Street, La Quinta from 8 in the morning till noon. Again, for a full list of all the blood drives and the two blood centers, 1-800-TRY-GIVING or LStream.org. Doctor, let's make it a solid final month plus here of the Summer Blood Drive Challenge out here in the Coachella Valley. Get out of the heat, get into a nice, cool blood donation center, and save somebody's life. We couldn't ask for anything more, could we?
No, and what I want to reinforce to everybody listening is how many opportunities do we have in our lifetime to help save somebody else's life. And the simple act of donating a unit of blood, which takes an hour from start to finish with regards to having the history, donating the blood, sitting in the canteen, getting all these great refreshments and leaving, an hour of your time can help save up to 3 lives. And we don't have too many opportunities to be able to do that. And that's a really, really good feeling.
He's Dr. Rick Axelrod, President, CEO, and Medical Director of LifeStream Blood Bank. Dr. Axelrod, thanks so much for the work you do. Always great to catch up with you. Stay safe, and we'll see you at the Blood Bank.
Okay, thank you.
I'm Gene Nichols.